Yes, a lot. So sometimes not necessary initially, but I do quite, as I've already alluded about the loosening, this sort of loosening and effect, I do give it. So let's say it's plantar fasciitis, the calves are quite tight. I like to give a bit of laser just to help relax there. Now, what I find quite a lot, and a few other people have mentioned this, is people after about 3 or 4 treatments of shockwave, patients will start getting pain in the posterior sort of border of the heel. Now, the only way I can get my head around this, because I like to work out why that is the shockwave's working, which is great, but what's happening is because they've had a propulsive gait, they've had the calf muscles are tightening up, and because things are loosening up, they start striding more. So, and because of the tight calf muscles, they tend to put this pulling feeling, which can be quite painful on the posterior border. Now, I find that if you laser that area, just using the trigger point setting, so it's 20 seconds, that helps enormously with that discomfort. I use them both daily. It's rare if they don't both get wheeled out. So, they're both alongside one another. So they both get used.
Brilliant.
Daily. So if they haven't had it for a sufficient period of time, so my cutoff is 4 to 6 months for shockwave. If they've had it any less than that, it's laser straight away. But longer than that, I've sort of looked for a shockwave, but I have used laser as well. It depends on their pain threshold, because so some people will find shockwave just too painful. I've had 2 today, fun enough, where we've started off a shockwave and I've just switched to laser because, as in full laser, because they're just finding the shockwave too uncomfortable.
So when you're using shockwave, out of interest, do you use the ultrasound scanner first?
Oh, absolutely. Because I'm quite lucky where I am, is that the NHS don't have shockwave at all. So the consultants refer patients to me and I decide whether it's laser or shockwave. But if there's any suspicion it's anything more than a bog standard plantar fasciitis or Achilles tendonitis or an itis, then I use diagnostic ultrasound every time if there's any suspicion at all. So I had one again today. She's got some specks of calcification. Well, she forgot to tell me that was picked up on X-ray previously. So if there's any suspicion of anything more than that, then definitely use diagnostic ultrasound.